We are on number 10 of the patient doctor pain point series. They're out there, and I know they're out there because you told me and sent me messages. So number 10, being overwhelmed by conflicting medical opinions. Dr. A says one thing, Dr. B says another. Who am I supposed to listen to, and what am I supposed to do with that? Now, Dr. A and Dr. B. So one thing I want us to be careful of is the reason why we call ourselves primary care doctors, right? Because primary care should mean one. So I want to make sure that you guys know about the importance. You know, already wrote bond, trust, respect, empathy, communication. It's all about getting the right patient-doctor bond. So hopefully when you find that bond, you get that primary care doctor. Because when I got this message, it made me think a little bit about who has one doctor here and another doctor here. And you're right, that can be quite conflicting. And so it's important that you have the primary care doctor, number one, so that there isn't a conflict. Number two, I want to make sure you kind of believe in the doctor that you've chosen, or that feels like a fit for you based on what they're saying from their training and so forth. If not, then there's some other things that should take place. I'll tell you this as well, which is the other thing that's unique about what you asked. So one of the big things that I do, I'm a concierge physician, as you guys know, but the other thing I do, and the largest part, is I'm a consultant, right? So there's a lot of people, some of you, who will come, you already have your primary care doctor, but you want someone, just another pair of eyes, another direction. And then obviously sometimes things just don't make sense and they're not a fit, and communication's an issue, and you reach out. Those sort of things are different, right? Because when someone like myself or other docs that are medical consultants or medical advocates, it's a little bit different, because we still keep your primary care doctor, but we're just kind of here to kind of, we're just kind of there, I should say, rather, just to kind of hone the edges, just to try to make sure everything makes sense. Or more importantly for me, when I do that sort of work, is I just want to make sure that you feel like you have an education of what's going on, that you feel like we have a plan and a direction of what we're doing, so that sometimes, different communication styles work. And so therefore, when I'm doing medical consultant work, or if you look for a consultant and not another primary, you may find that some of that confusion isn't necessarily there. And this leads me to another topic. So you mentioned here that Dr. A says one thing and Dr. B says another. You made me think about something else with patients that you guys do a lot of. And I think this is a great thing. Patients used to come into the office and they would come with a couple of sheets of paper of the newest thing, the newfangled fad, or questions about a medication they're on and so forth. I love that, because once again, that gets back into that learning, that gets back into that sharing, that gets back into that partnering, and that gets back into that bonding and so forth. So these things can be overwhelming as well. So when this particular person here, everyone mentioned Dr. A and Dr. B, it also let me think about the most, I was going to say famous. Is it infamous or famous? I don't know. But Dr. Google, I guess it depends on how you say it. And also Dr. TikTok is right behind her. So once again, I think these are good resources here and there. But it all gets back to that number one doc, that primary care doc that's there, so that you shouldn't necessarily be thinking about Dr. A and B, because I want you to have one that you're really focused on and that you think is really focused on you. If you go the consultant route, don't forget that consultant stuff that I do isn't your primary, but there to help support your primary, or support some of the holes that may have gotten there. And then the other thing is, if you look for other medical direction, TikTok or Dr. Google or any of those things, bring it back to us. Let us make sure it fits you in your situation. That's one thing. Look, Dr. Google, Dr. TikTok, they seem pretty darn smart, don't they? Yeah, but guess what? They don't know you. They don't know what makes you tick. They don't know everything else that's going around. We do. So I say all that. Let's partner up on that. But above all, this person here shouldn't be overwhelmed, especially if they make sure they focus on one, and make sure they're sharing their information with their doctor. So all of that confusion goes away. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.